We are going to see a topic as ERCP. Endoscopic Retrograde Cholangiopancreatography is a specialized endoscopic technique to evaluate the bile ducts, pancreas ducts, and gallbladder. ERCP is the gold standard to access these ducts to remove stones, open up blockages, and even diagnose cancers. What is an ERCP? An ERCP is a procedure that is done to allow your physician the ability to examine the bile and pancreatic ducts. A flexible lighter tube known as an endoscope is inserted into the mouth and down the throat. This goes down into the stomach and an upper part of the small intestine. Why do I need an ERCP? An ERCP is typically performed to diagnose and treat specific conditions of the bile ducts, pancreas, or possibly gallbladder. ERCP can also be used to diagnose and then remove bile duct stones. Benign and cancerous tumors are also diagnosed and treated using this procedure. Sometimes an ERCP may be used for complications from gallbladder surgery as well. For patients who have pancreatic disease, the ERCP can help determine whether surgery is needed and if so, what type of surgery it should be. Also, sometimes pancreatic stones are removed using ERCP. What should I do to prepare? For an ERCP, you will need to have an empty stomach, which means you should not eat or drink for a minimum of 8 hours before the test is done. Your doctor may give you a more specific time frame for beginning fasting, depending on when the test is scheduled. There may also be adjustments made to your current medications, such as blood thinners and insulin. What happens during the ERCP? An anesthesiologist will give you IV sedative to make you completely asleep for the procedure when it happens. When you are asleep, an endoscope will be passed through your mouth into the intestines. This will not interfere with your ability to breathe. From inside the intestines, the endoscopist evaluates the bile and pancreas ducts with a combination of tools and dye. The procedure typically takes less than 1 hour to complete. What happens after the procedure? After the procedure, you will be monitored in the recovery area while you wake up from anesthesia. This will give you time for the sedative to wear up. You may find your throat is sore for a couple of days. You will be able to use medication and eat as usual once the procedure is complete. Are you interested in learning more about ERCP or medical conditions requiring its use? Dr. Prashant Kedia is a therapeutic endoscopist and gastroenterologist serving patients in the Dallas-Fort Worth area and beyond.